Hi everybody, it's Richard McMunn from the interview training company howtobecome.com, and in this training video I'm going to help you to pass your healthcare assistant interview, and in particular I'm going to give you a number of sample interview questions and suggested answers that you can use during your healthcare assistant interview. Before we get into it, a very warm welcome to this tutorial. That's me there on the right hand side. My name is Richard McMunn. I've been helping people like you to pass interviews for over 20 years now, and in this particular video we are going to focus on the healthcare assistant interview. Don't forget, as always, please do make sure that you subscribe to the channel by clicking the red button below the video. That way you won't miss out on any of the training videos that I upload on a weekly basis. Also, if you do like this video and the content and the answers to the questions I'm going to give you, please do give the video a thumbs up, because that always motivates me to do more. If you want to tell me the name of your healthcare assistant interview or the NHS trust that you're applying for, in the comments section below this video, I'll also give you further interview questions to prepare for in preparation. Okay, let's get straight into the questions and answers. Question number one of your healthcare assistant interview. Why do you want to be a healthcare assistant? Well, 3 tips, really important tips for answering this question. Number one, make sure you split your answer into 2 parts. First of all, why you want to be a healthcare assistant, and then what qualities you can actually bring to the role. And like I say, I'm going to give you a sample response in a second. Make reference to the NHS Trust values in your response. You just have to mention them, okay? And I'm also going to be referring to these later on in this presentation. Also refer to the job description. So what you want to be saying is that you've studied the job description and you have the skills and qualities to match the role. That way they know that you've looked at the job description, which they say is really important on the NHS Trust website, so make sure you do refer to it. Okay, here's my sample answer for you. For the interview question, why do you want to be a healthcare assistant? Here we go. I've always had a passion for helping people, and my education and studies have been predominantly centred on these 2 areas. Having researched the job description of a healthcare assistant within the NHS in detail, and also having checked the required competencies for the role, I feel I would gain a lot of job satisfaction from the position and would feel confident I could contribute positively to your team. I'm a hard-working, professional, conscientious and loyal person who would do all they could to work towards achieving the NHS Trust values. I would do this by being competent in my role at all times, providing both safe and outstanding care, whilst consistently looking for ways to improve my skills within the position as time progresses. So that says that you're referring to the trust values, you've looked at the job description, you are saying why you want to be a healthcare assistant, and you're saying what qualities and attributes that you have that you can contribute to the role effectively. Okay, question number 2. What are the 6 C's, and which, in your opinion, is the most important? So 2 tips for answering this question. List the 6 C's and say they are all as important as each other, okay? Because they are all really important. So I'll tell you what they are in a second, but choose one of them that you think is the most important and then say why to back up your choice. Now I'm going to tell you which one I think is the most important and the reasons why. So you can use that if you want to. So here's my sample answer for you. For the interview question, what are the 6 C's and which, in your opinion, is the most important? The 6 C's are care, compassion, competence, communication, courage and commitment. The 6 C's are embedded into everything all nursing, midwifery and care staff do within their role. Now, whilst I genuinely believe they are all as important as each other, if I had to choose one, it would be competence. Competence in your role as an NHS healthcare assistant means 3 things. Firstly, it's about knowing your role inside out whilst following all safety protocols and procedures. Secondly, competence is about delivering first-class care to the people you are responsible for. And thirdly, competence is about continually developing in your role so you can constantly strive to exceed expectations. That, in my opinion, is a solid, brilliant answer to that interview question. Okay, next healthcare assistant interview question. How would you deal with an aggressive patient, which, let's be honest, is likely to happen during your role? So it's actually a scenario-based situation question that you have to respond positively. Here are 3 tips before I give you the suggested answer. Tip number 1, safety is absolute priority here, so make sure you mention safety. Say you would conduct a risk assessment, use those words. I would conduct a risk assessment and gather as much information as possible about the patient, but also their needs. Finally, utilize effective communication skills at all times. So that's being conscious of what you say and how you act. So here's my suggested answer for you. For the interview question, how would you deal with an aggressive patient? First and foremost, I would follow my training, operational procedures and protocol at all times when dealing with a patient. I would conduct a risk assessment to assess the scene and the situation and would ensure the patient and surrounding staff was safe from any objects that could potentially be used to cause harm. I would also gather as much information about the patient and their needs as possible. This in turn would enable me to conduct a thorough risk assessment and put in place the appropriate safeguards. I would utilise effective communication skills when talking to the patient by speaking in a calm manner, using open body language and also the correct tone of voice. At no stage would I either be condescending or patronising. I would choose my words carefully. I would also ensure there was a system in place to both raise the alarm and request assistance quickly if needed. Finally, I would always maintain a safe exit route when in a room with the patient, just in case a situation escalated whereby I needed to protect myself and others. So another solid response to that healthcare assistant interview question. Don't forget, if you do have any kind of interview coming up, please make sure you put it in the comments below. Tell me what it is and I will give you a list of questions to prepare for in addition to these. Don't forget, if you also like the video, I would very, very much appreciate it if you gave it a thumbs up. Moving on, how would you feel dealing with challenging behaviours? So how would you feel dealing with challenging behaviours? Because as an NHS healthcare assistant, you're going to be doing this probably on a daily basis. So here's my response for you for this question. I am confident I would be absolutely fine when dealing with challenging behaviours. Not only do I have some experience of this already, but I regularly refer back to my training and my operational protocols as I feel these are important resources that give me confidence in my abilities to perform the role to a high standard at all times. I would also ensure I utilised any support mechanisms the NHS Trust has in place for support staff to de-stress and to talk to others if the situation was needed. I believe using these services is fundamental to maintaining a healthy, positive mindset whilst at work as a healthcare assistant and would see the use of them as vital within my role. I believe it is also very important within this role to identify the triggers that can cause you to become stressed when dealing with challenging behaviours. If I feel or see these triggers developing, I would seek help immediately. Finally, outside of work, I like to keep fit and healthy, which I also feel is a fundamental part of maintaining a positive mindset. Another really solid response that you can use during your interview. Next question, what's your understanding of confidentiality? So as an NHS healthcare assistant or any role within the NHS, you have to abide by confidentiality. So you have to understand what the code of conduct is. So 2 tips for answering the question. Tip number 1, know how confidentiality impacts your role within the NHS and also refer to the confidentiality code of practice. I'll tell you what it is in a second. Make sure it's up to date and relevant for your NHS trust before using this. Here we go. Confidentiality is crucial to the role of a healthcare assistant and also to anyone else working within the NHS. It is important in order to develop appropriate patient relationships. Without confidentiality, patients would be reluctant to seek medical help or to give sufficient information for medical staff to provide the appropriate care and/or treatment. Patients entrust us with or allow us to gather sensitive information relating to their health and other matters as part of their seeking treatment. They do so in confidence and they have the legitimate expectation that staff will respect their privacy and act appropriately. Next question. What would you do if you were asked to operate against manual handling protocols? So you are likely to be in a situation as a healthcare assistant where you have to do something quickly and you might not be able to follow the rules. So obviously there's a danger of doing that. You are then demonstrating you are a risk taker because you could become injured, but also the patient could become injured too. And then there could be a claim against the NHS and there could be problems. So 2 tips for answering this question. Under no circumstances should you operate outside of protocol. To say you would demonstrates you take unnecessary risks. Be firm in your response and always follow protocol. Make sure you abide by the rules when responding to interview questions of this nature. So here's my answer for you. Regardless of the situation, I would not undertake any manual handling task without the proper and appropriate equipment. If I were to operate against the manual handling protocols, not only would I put myself in danger, I could also be putting the patient in danger too. Manual handling protocols and procedures are put in place for a reason, and on that basis there are no exceptions to not using them. So that's a short, punchy, but to the point response. So you're not saying, yes, I would take any risks. Because if you do, if you were to say, and some people would say, well, it depends on the situation. If I needed to do it quickly, I'd probably just, not use the protocols. Well, that's wrong. Okay, you can't. And it demonstrates that you are likely to take unnecessary risks. Okay, if you would like some more help, first of all, you can connect with me on LinkedIn. I've put the description to my LinkedIn profile in the description. Connect with me there if you'd like to. But to get more free training advice from me, you can get instant access to my online interview training course, literally within 2 minutes flat, by going to the website passmyinterview.com. I've also put the link in the description below the video, so you can go there if you want to. Also, don't forget to tell me the name of your NHS interview if you have one coming up. And that way I'll give you a list of interview questions. Make sure you subscribe. And also, like I say, I'd really appreciate a like of the video. That motivates me to do more for you. And the final thing is, I just want to say really genuinely good luck in your interview. And I hope you become a healthcare assistant. Thank you very much for watching.